Since 1997, the International Foundation for Functional Gastrointestinal Disorders has identified April as Irritable Bowel Syndrome Awareness Month. Studies estimate that IBS affects around 15% of the adult population. However, only 5 to 7% of adults have been diagnosed. The specialists at Advanced Gastroenterology and Surgery Associates explain by excluding certain variables, they can pinpoint the diagnosis and treatment for IBS.
Irritable bowel syndrome is a chronic condition, and the most common reason that we actually see a lot of patients. In the past, we called it a diagnosis of exclusion. However, now there are sort of definitive parameters. You can actually make a diagnosis just based on the patient's symptoms. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements. If there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. There are many various things that potentially could cause it. Stress. Patients usually have more stressful situations when they get their symptoms. There is an entity of post-enteric irritable bowel, where patients who've had any gastrointestinal illness may develop symptoms of irritable bowel. The symptoms may linger. They may get better, but linger a bit longer than they normally do. So a lot of patients after an event, we know that something triggers it. It could be virus, could be bacteria, could be a food toxin, but it triggers this abdominal pain with changes in motility of the bowels.
IBS affects about twice as many women as men and is most often found in people younger than 45. We've included links to more information on irritable bowel syndrome, as well as contact information for AGSA under the IBS Awareness Month StoryLink icon on our homepage at yourhometownhealth.com.